Bismillahirrahmanirrahim. Quote of the day: failure is not fatal until we surrender. Trying again is the key of glorious victory. Today, the topic of my presentation is National Health Vision 2016 to 25, and I am presenting it under supervision of Professor Dr. Sarah Afzal. Learning outlines. Learning outlines of my presentation will be introduction to National Health Vision, its purpose, objectives, and guiding values. And the next second for thematic pillars of the National Health Vision, that is from 5 to 8. And in the end, recent updates and MCQs. Learning outcomes. By the end of this presentation, participants will be able to know about the second four thematic areas of National Health Vision, challenges and strategies for these four thematic areas of National Health Vision 2016 to 2025. National Health Vision. The National Health Vision 2025 has been designed in line with WHO Health System Framework using the 6 thematic pillars: health financing, health service delivery, human resource for health, health information systems, governance, essential medicines, and technology, in addition, area of cross-sectoral linkages. WHO provided the support to its development process of conceptualization, advocacy, and technical inputs. To execute the federal functions, Ministry of National Health Services Regulation and Coordination was recreated in 2013 with the mandate to provide a common strategic vision to guide the health sector according to the Government of Pakistan's Vision 2025, which is to achieve universal health coverage through efficient, equitable, accessible, and affordable health services. The National Health Vision 2016 to 25 is a result of the Pakistan Vision 2025 that was developed by the Ministry of Planning, Development and Reforms. National Health Vision document is the product of many meetings, discussions, and debates over a year under the aegis of the Ministry of National Health Services Regulation and Coordination, with eventual consensus involving every section of the society. This vision is owned by both the political and administrative leadership of the health sector and the overall political and administrative arena of the country. Now, the main vision statement of this National Health Vision is to improve the health of all Pakistanis, particularly women and children, by providing universal access to affordable, quality, essential health services which are delivered to a resilient and responsive health system capable of attaining the sustainable development goals and fulfilling its other global health responsibilities. Now, the purpose of this vision is to provide an overarching national vision and agreed upon common directions, harmonizing provincial and federal efforts, interprovincial efforts, and intersectoral efforts for achieving the desired health outcomes and to create an impact. It provides a jointly developed account of strategic directions to achieve the common vision, and which gives a guideline of best practices for the provinces to carve their respective policies and initiatives within their domains. National Health Vision Guiding Values. The National Health Vision strives to provide a responsive, unified national direction to confront various health challenges while ensuring adherence to universal health coverage as its ultimate goal. The principal values include good governance, innovation and transformation, equity and pro-poor approach, responsiveness, transparency and accountability, integration and cross-sectoral synergies. This vision aims to resonate with the ideals and expectations of provinces. The federal government will support and facilitate the provinces in developing and implementing their strategies by providing the overall vision and by facilitating for financial and technical resource mobilization to ensure that essential health services are accessible to all citizens. National Health Vision Objectives. It has adopted the following objectives in order to improve the health and well-being of the Pakistani society. Number 1 is provide a unified vision to improve health while ensuring provincial autonomy and diversity. Build coherence to federal and provincial efforts in consolidating the progress, learning from experiences, and moving towards the universal health coverage. facilitating synchronization for commonality across international reporting and international treaties, and facilitate coordination for regulation, information collection, surveillance, and research for improved health system. It provides a foundational basis for charting and implementing sustainable development goals in partnership with other sectors. Thematic pillars. The National Health Vision 2016 to 2025 builds its narrative on 8 thematic pillars to ensure access, coverage, quality, safety, essential requisites for achieving the ultimate goal of universal health coverage in Pakistan. The challenges and strategic vision for each thematic pillar form the basis of the overarching technical support that the federal government will offer and coordinate for the provinces. Now, these are the following 8 thematic pillars, which we have already discussed yesterday. Health financing, packaging health services or health services delivery, human resource for health, health information system, governance, essential medicines and technology, cross-sectoral linkages, global health responsibilities. As the first four have already been discussed yesterday, I will discuss from the governance each one by one. Pillar number 5, governance. The challenges covered under this thematic pillar are that governance has been a constant challenge, undermining service of delivery and budgetary investments. As in other sectors, patronage often has a significant role in determining the agenda for health policies and administration in Pakistan. The capacity to regulate public and the private sector health market, that is, medical practice, pharmaceutical, and diagnostic, is weak. There is no uniform approach for managing the governance of health institutions, and capacity for contracting services is not optimal. So the strategic vision for these challenges are: federal and provincial health authorities must rebuild their stewardship of the health system through professional independent advice and technical governance of health services planning. They must strive to become the frontline providers of essential health services provision and delivery. A steady and purposeful stewardship role of the provinces should bring structural changes to the health system. It is expected that sector-wide strategic planning, regulation, purchasing, financing, separate service provisions from a stewardship function. Health services reform that are already underway should focus on strengthening government-provided services. Innovative management models that align with preventive primary health targets should be tested. Private sector should be seen as a partner in healthcare delivery and should be engaged and regulated through appropriate mechanisms. It should be engaged to meet national sustainable development goals targets. Increased share of public sector budgets and commitments for governance, strengthening and establishing dedicated structures within provincial federal ministries. Both government and private service providers will be involved in performance accountability and targeted service delivery. Accountability mechanism must be put in place at all levels. Development of key performance indicators and output-based measures facilitate progression to performance-based models. Now, it is 6, essential medicines and technology. Challenges. Health sector technologies have not been introduced through a needs assessment process leading to an unchecked misuse. The current mechanisms to determine the appropriateness of health supplies, diagnostics, medicines, and laboratory reagents are not evidence-based. The essential service package does not identify the type or number of equipment, supplies, medicines needed to deliver the defined services for a specific health facility. This encourages irrational procurement, use, and spending on technology and results in the loss of precious resources. There are problems related to quality and price of drugs and prescription. Medicine pricing is a continuous issue between regulators and the industry. Plans for a health technology assessment using pharmacoeconomics, pharmacoepidemiology, and pharmacovigilance have not advanced. So strategic vision to overcome these challenges are to create health technology assessment capacity at federal, provincial, district levels, and vigilantly monitoring the selection, quality, price, and use of technology, equipment, and medicine as per international standards. collect evidence and best practices on medicine-related policy, legislation, operative guidelines to develop standard treatment guidelines, establish an entity to oversee adherence to standard treatment guidelines and best practices. The federal and provincial government will ensure that appropriate regulations for the control of drugs, devices, diagnostics, and biological reagents across the country are established to ensure quality control and patient safety. Pharmaceutical industry will be encouraged to provide innovative and affordable solutions to patients and to introduce a pharmacovigilance program at the federal level and at provincial collection centers. Drug pricing policy will be implemented to protect the public interest by regulating prices of essential medicines. Appropriate policies for orphan drugs, alternative medicines, and medical devices will also be put in place. Strengthening the Drug Regulatory Authority of Pakistan and revised legislation to regulate drugs, human organ donations, blood transfusions, and all therapeutic goods. Pillar number 7, cross-sectional linkages, challenges. Public health professionals are becoming increasingly aware that their field is affected by the political, social, economic, and developmental context in which they operate. Illiteracy, unemployment, gender inequality, food insecurity, rapid urbanization, environmental degradation, natural disasters, and the lack of access to safe drinking water and sanitation. These all have negative effects on the health of individuals and communities. A large number of preventable deaths and disabilities among children, pregnant lactating women, young adults, and the aging population could be averted, but action lies beyond the scope and mandate of the health sector. Population growth calls for concrete steps to increase the contraceptive prevalence rate and reduce the total fertility rate. Strategic vision. There will be renewed and synergistic focus on cross-sectional actions to advance health with a particular focus on communicable and non-communicable disease, including mental health and malnutrition. The concepts of One Health and health in all policies will be promoted. Government will strive to develop a common vision, framework, and platform with stakeholders from across sectors to work on health-related priorities such as population, education, food security, agriculture, livestock, housing, sanitation, and disaster management. Government will embark upon advocacy, planning, legislation, regulation, behavioral change communication, information exchange, and evidence-based decision-making through joint efforts with various sectors in pursuit of the Sustainable Development Goals. Efforts will be geared towards recognition of community involvement, women empowerment, and local development will be the key channels for cross-sectoral action. Now the last pillar, pillar number 8 is global health responsibilities. Challenges covered in this pillar are the sustainable development goals and the broader sustainability agenda demand much more effort than the Millennium Development Goals and must include addressing the root causes of poverty, investment in human development that benefits all people. Achieving international public health security is one of the main challenges arising from the new and complex landscape of public health. Treaties such as International Health Regulation and Global Health Security Agenda require core capacities that have not been developed at federal or provincial levels. Progress on other treaties and commitments such as Framework Convention on Tobacco Control, Mental Health Gap Action Program, Reproductive, Maternal, Newborn, Child and Adolescent Health, Family Planning, etc. are hindered by a lack of coordination. Strategic vision. The new Global Sustainable Development Agenda will be reflected in all health strategies and plans, and the government will be provided appropriate technical support and expertise. Mechanisms for coordination across sectors and between provinces and federal ministries, including integrated disease surveillance and response, as indicated in the IHR 2005 and Global Health Surveillance will be established to prevent, detect, and respond to events that may constitute a public health emergency. Adopt best practices for polio eradication and apply to other priorities, particularly expanded program for immunization and vaccine preventable disease surveillance. Government will develop a strategic and coordinated approach to facilitate adherence to sustainable development goals and other international treaties by providing an enabling environment and guiding guidance to all the stakeholders. Monitoring and evaluation. A monitoring and evaluation mechanism would be developed for the National Health Vision 2016 to 25. It would be in the shape of an monitoring and evaluation framework and plan linked and coordinated with the Planning Commission for SDG reporting, provincial and region health departments for alignment with strategies and other stakeholders. The Ministry of National Health Resource Company will coordinate for these functions. The monitoring and evaluation plan would describe in detail the specific roles of different facets of the health system, the processes of data acquisition, flow, analysis, use and feedback, resource requirements, institutional infrastructure needs, analysis of currently available competencies and capacities, and specific indicators and their timelines for gauging performance and results. It will also define how different levels of government can utilize the data and information from such a system and even suggest corrective actions where needed. National Health Vision as a success story. Pakistan's history with developing a health policy has been bumpy. From 1947 to 1990. There was no health policy in Pakistan. The first policy was developed in 1990 and focused on school health, family planning, malaria control, communicable diseases, as well as focus on water sanitation and hygiene. This policy was followed by the second national health policy in 1997, which also focused on health promotion and education and prioritized national health programs. The third iteration of health policy took up the health for all approach and focused on a 10-point agenda for health sector reforms and resolving primary healthcare level issues. The final policy developed by the Federal Health Ministry was drafted in 2009 and was built on the 6 building blocks of the health system. National Health Vision is a success story. Also state that it is a consensus-based document which offers a unified vision to improve health while ensuring a provincial autonomy and diversity. It allows a coherence to provincial and national health planning and offers a comprehensive mechanism to align Pakistan's targets with the internationally committed agendas like international health regulations, sustainable development goals. Hence, this document represents an excellent example of coordination and consensus building in the devolved setup, which will offering a framework for future collaboration in the country. National Health Vision and Punjab Government, that is Punjab Health Sector Strategy 2019 to 28. The government of Punjab taking forward the intent of the newly elected political leadership to reform and restructure Punjab health sector towards better performance has pursued the development of 10-year Punjab Health Sector Strategy 2019 to 28. The strategic roadmap being a basic requirement to a financial resources to intents has been developed with valiant rigor. This strategy is a sequel to and is in consonance with achievements and gaps falling out from the previous health sector strategy 2012 to 20 made as a result of post-18 amendment of Pakistan and bifurcation of Health Department Punjab. Now moving into recent updates. This is the article titled as Pakistan's Health and Population Think Tank, a policy platform for achieving Sustainable Development Goal 3 national targets. In Pakistan, the Health and Population Think Tank was formed and notified in 2017 under the aegis of the Ministry of National Health Services, Regulation and Coordination. Hence its composition, and the mandate given classified it as a government-linked think tank. Pakistan Health and Population Think Tank was launched as an initiative to conduct programs and policy analysis, as well as given an insight into the possible future policy options on various national health issues relevant to all the provinces. It is a platform to discuss how provincial strategies would be aligned with the National Health Vision 2016 to 2025. The role of health and population think tank is not to design or develop policies, but to generate evidence for provinces on what has worked and what can be conceptualized. Oh, country cooperation strategy for WHO and Pakistan 2020-2025. WHO's country cooperation strategy for Pakistan was recently signed by the Special Assistant to the Prime Minister on Health, Dr. Faisal Sultan, and a WHO representative in Pakistan. The country cooperation strategy reflects the medium-term vision of WHO for technical cooperation with the government of Pakistan. It is aligned with national policies and plans, 12 national 5-year plans, National Health Vision 2016 to 2025, Ministry of National Health Services, Regulation Coordination Action Plan 2019 to 2023, WHO's 13th Journal Program of Work, and the United Nations Sustainable Development Goals Framework 2018 to 2022. The country's cooperation strategy reflects the medium-term vision of WHO for technical cooperation with Pakistan. It aims to bring together the strength of WHO support at 3 levels of organization in a coherent manner. This strategy for Pakistan is the result of an analysis of the health and development situation and WHO's current program of activities. It is structured around 3 strategic priorities to ensure healthy lives and well-being for all at all ages. One is advancing universal health coverage. Second is addressing health emergencies. Third is promoting healthier populations. So WHO is committed to supporting the government in achieving universal health coverage and the health-related sustainable development goals for a healthier population of Pakistan. Multiple choice questions. MCQ number 1. Which one of the following statement correctly pertains to Vision 2016 to 2025? A. To improve the health of all Pakistani women and children by providing universal access to essential health services to attain the sustainable development goals and fulfilling its other global health responsibilities. To improve the health of all Pakistanis, particularly old and sick people, by providing universal health access to essential health services to attain the SDGs and fulfilling its other global health responsibilities. To improve the health of all Pakistanis, particularly women and children, by providing universal access to essential health services to attain the SDGs and fulfilling its other global health responsibilities. D is to improve the health of all Pakistanis, particularly women and children, by providing universal access to specialized health services to attain the SDGs and fulfilling its other global health responsibilities.
C.
Yes, C is the right answer. MCQ number 2. A newly established health lab in Lahore needs permission to operate. Regularization of labs comes under purview of governance, essential medicine and technology, packaging health services, global health responsibilities. Which of the thematic pillar is responsible for it? Any idea? It comes under purview of governance. A is the right answer. MCQ number 3. National Health Vision 2016 to 2025 recognizes universal health coverage as top priority among Pakistan's healthcare objectives and is aligned with national programs and policies such as the Poverty Reduction Strategy and Poor Social Protection Initiatives. The main focus of universal health coverage is aimed at primary healthcare, secondary healthcare, tertiary healthcare, quaternary healthcare.
A.
Yes, there is A. Yes. MCQ number 4. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, is the fundamental right enriched in the WHO Constitution. To realize this fundamental right on healthy lives and well-being for all, WHO has hosted Regional Health Alliance to accelerate the achievement of the SDGs by implementing Global Action Plan, National Action Plan, Regional Action Plan, Local Action Plan. The right option is A, Global Action Plan. MCQ number 5. Government will strive to develop a common vision, framework, and platform with stakeholders from across the fields to work for health, such as population, education, food security, housing, environment, and disaster management. Which of the following pillar covers this strategic vision? Health service delivery, essential medicine and technology, global health responsibilities, cross-sectoral linkages.
D.
Yes, D is the right option. MCQ number 6. One of the challenges in health sector is related to quality and pricing of drugs and prescriptions, which can be resolved by strengthening the Drug Regulatory Authority of Pakistan. By doing so, which of the thematic pillar of Vision 2016 to 25 was addressed? Governance, essential medicine technology, global health responsibilities, cross-sectoral linkages.
B.
Yes, right option is B. MCQ number 7. Choose the correct role of Pakistan Health and Population Think Tank to design the health policies in accordance with Vision 2016 to 25, to develop the health policies in accordance with Vision 2016 to 25, to discuss how health strategies can be aligned with Vision, to seek technical help for partners in accordance with the Vision 2016 to 2025. The right option is C. MCQ number 8. Doing a sector-wide strategic planning for purchasing and financing comes under purview of governance, essential medicine and technology, packaging health services, global health responsibilities.
A.
Yes, right option is A. MCQ number 9. Health technology assessment capacity will be created at federal, provincial, district level, with governments being vigilantly monitoring the selection, price, and use of equipment and medicines as per international standard. Which of the following thematic pillar proposes strategic vision? Health service delivery, essential medicine technology, global health responsibilities, or cross-sectoral linkages? The right option is B, essential medicines and technology. MCQ number 10, who will coordinate a monitoring and evaluation mechanism developed for the National Health Vision related functions, as it would be in the shape of monitoring and evaluation framework and plan linked and coordinated with the Planning Commission for SDG reporting, provincial and area health departments for alignment with strategies and other stakeholders. Options are Ministry of National Health Services Regulation Coordination, Planning Commission of Pakistan, Ministry of National Food Security and Research, Ministry of Finance. A is the right option. Ministry of National Health Services Regulation Coordination is responsible for coordinating a monitoring and evaluation mechanism which is developed for National Health Vision. This is the key of MCQs. Thank you.